Good day, nurses. Today, for our recorded lecture, we are going to discuss your drugs acting on your cardiovascular system. So first, we have your cardiac glycosides natin. Okay, pag sinabi kasi natin cardiac glycosides yan, class, these are group of drugs derived from your digitalis plants. Okay, digitalis or your foxgloves plants. Okay? Wait lang, foxgloves plants. Wherein, yung ating digitalis is actually a substance, na galing that occurs naturally in your foxgloves plants natin. Okay? So, the most commonly used cardiac glycosides is what we have your digoxin. Okay? So, pag sinabi nating digoxin yan, class, it is indicated for patients with number 1, to treat your CHF or your congestive heart failure. Next is for atrial fibrillation, your atrial flutter, and your supraventricular tachycardia natin. But then we're just going to focus on your CHF. Okay? Pag sinabi kasi natin CHF or your congestive heart failure, I should say, that is a condition wherein your heart already fails, to pump blood around your body effectively. Okay, ibig sabihin nun, kapag nagkaroon ka ng congestive heart failure, ang magiging result nun, possible na magkaroon ka ng very low cardiac output. Aside from that one, bababa din ang iyong blood volume na tinatawag natin. Okay, bababa ang ating cardiac output or your volume of your blood being pumped by the heart that possibly result into what? Dalawa lang po yun. Magkakaroon ka ng tinatawag na congestion. Kaya nga from the word itself, congestive, ibig sabihin nagkakaroon ng congestion. Ano bang ibig sabihin ng congestion? Ibig sabihin nun ay nagkakaroon ng fluid build up. Okay, ano ba yung dalawang natin, sir? Ano ba yung possible na magiging result nito? Of course, sabi natin merong congestion of your fluid. It can be what? Pulmonary and your systemic congestion natin. Ngayon, ang nangyayari kasi because our cardiac cycle, normally it involves the tawag dito, dapat merong balance yan, between your pumping of your right and your left side of your heart. Wherein, once na nagkaroon ng problem or nagkaroon ng failure in your myocardium, okay, or the muscles of your heart, okay, to pump blood out of either side of the heart, it can actually result to what? Back up of blood. Ibig sabihin ng back up of blood, nagkakaroon ng possible na regurgitation. Ngayon, that is why sabi natin meron kaninang dalawang congestion. It can be a pulmonary congestion or it can be a systemic congestion. That is why it will give a rise to your what? Dalawang klase ng congestive heart failure natin. Number 1, we have your left-sided heart failure natin. Wherein kapag sabi natin kanina left-sided heart failure, it is a nagkakaroon ng pulmonary congestion. How about on the other side, we have your right-sided heart failure. We have your systemic congestion. Okay, so this concept class, yung ating congestive heart failure, it will be discussed broadly, more on your possibly sa pathophysiology or mismo sa mismong medical surgical nursing yung pag nag-third year kayo. Okay, basta at least alam niyo na kapag congestive heart failure yan, nagkakaroon ng tawag dito ng congestion. It can be in your it can be a pulmonary congestion or your systemic congestion. Basta may dalawang klase yan. We have your left-sided heart failure and we have your right-sided heart failure. And then the rest of this itong mga disorders na to, cardiac disorders, you have your AFib, A-flutter, your supraventricular tachycardia. These are actually tawag dito cardiac dysrhythmias. Okay, nagkakaroon ng problem sa rhythm of your heart natin. So ngayon, ang ating digoxin, ang kanyang mechanism of action, nakalagay dito, it inhibits your sodium, okay, your sodium, potassium, ATP or activated ATP. Anong ibig sabihin ng ATP natin? That is your adenosine triphosphase natin. Your adenosine triphosphase or your sodium, potassium, activated adenosine triphosphase, that is actually what? An enzyme po yan. Okay, enzyme po yan. It is an enzyme, that regulates the amount of your sodium and your potassium inside your cell natin. Ngayon, if you're going to inhibit this enzyme, anong mangyayari, sir? It will result to what? It will result to an increase in intracellular sodium and your calcium natin. Hindi ko lang siya nasulat. Okay, calcium. Okay, intracellular sodium and your calcium. Class, ang tandaan lang natin, no, ang ginagawa kasi ng ating mga cardiac glycosides, these are just drugs, no, that increases your intracellular calcium and allows more calcium to enter in your myocardial cells natin during the depolarization na tinatawag. Ang ginagawa lang niya, ini-increase niya, nakalagay nga dito, it leads to an increased influx of calcium inside your myocardial cells. Ano bang ginagawa kasi ng calcium natin, sir? Your calcium is an electrolyte that helps with the contraction of your heart. That is why ang ginagawa ng ating digoxin or your cardiac glycosides in general, ini-inhibit niya ang ating sodium-potassium activated ATP para magkaroon ng increase in your intracellular sodium and your calcium inside your myocardial cells natin. Ngayon, kapag nasa loob na ng ating myocardial cells ang ating mga calcium, ano bang mangyayari? Your cardiac muscle fibers will what? Contract efficiently. Mas nagiging maganda yung contraction ng heart natin. Ini-increasing force ng contraction ng ating heart. Yun po ang ginagawa ng ating cardiac glycosides natin. Ngayon, dito sa ating meron din tayong nakalagay na iba't ibang effects, no? Iba't ibang effects ng ating cardiac glycosides, specifically your digoxin in your heart. Number 1, we have your positive inotropic action na tinatawag. Next, we have your negative chronotropic, and also we have your negative domotropic action natin. Ngayon, dito tayo sa ating positive inotropic action natin. Ang nangyayari sa ating positive inotropic action, it increases your what? Ang effect niya sa ating cardiac cells natin or your myocardial cells. Ang epekto ng ating positive inotropic action, it increases your what? Increases your myocardial contraction natin. Pinapaganda niya or ini-increase niya mismo yung force ng contractility ng ating puso. Yan po ang tinatawag natin na positive inotropic action natin. However, on the other side, we also have here your negative conotropic action. Kapag sinabi nating negative conotropic action yan, it what? It decreases your heart rate natin. It decreases your heart rate natin or ini-slow down niya yung mismong heart rate natin kapag negative chronotropic action po yan. Okay, on the other side naman po, you have your negative dromotropic action. Ang ginagawa po ng ang effect po nito sa ating heart is what? It also decreases yung conduction of our heart cells or yung mismong velocity kung gaano kabilis mag-conduct ng impulses yung ating heart through our what? Through our atrioventricular node natin. Okay, ulitin natin. Pag sinabi nating positive inotropic action yan, it increases yung mismong force ng contractility or ng ating myocardial contraction. Kapag sinabi naman nating negative chronotropic effect, ini-slow down niya ang ating heart rate. That is why sabi natin indicated po sa patient na merong what? Nakalagay dito, indicated yan for patient with AFib, A-flutter, and supraventricular tachycardia. Kasi kapag ganito, kapag sinabi nating mga cardiac dysrhythmic disorders yan, masyadong mabilis ang iyong heart rate. Okay? And aside from that, we also have your dromotropic action, negative dromotropic action. It slows down your what? Conduction of your heart cells through your what? Atrioventricular node natin. That is the mode of mechanism of action of your digoxin na cardiac glycosides. Ngayon, let's proceed with your tawag dito nursing considerations when you are going to administer your digoxin. Number 1. Okay, number 1, we have here, you have to always monitor for possible adverse effect natin. you have to monitor for possible adverse effect of your digoxin natin. Okay, ano ba yung mga possible na natin, sir? Ano ba yung mga possible na adverse effect natin, sir? Number 1, okay, pwede kang magkaroon ng fatigue, agitation, hallucination, and even with your arrhythmias. Yan po ang magiging possible na adverse effect of our digoxin natin. Okay? So, ang gagawin natin, sir, kapag nagkaroon ng problem, okay, nagkaroon ng possible adverse effect, it's because your cardiac glycosides natin class, meron siyang very narrow na therapeutic index, natin. Ibig sabihin, yung mismong toxic and your therapeutic range natin, medyo narrow siya. Okay? That is why possible si patient magkaroon ng toxicity from this medication. Okay? So, next to that one, okay, withhold the drug if the pulse rate, okay, or the apical pulse is less than 60 beats per minute. Kasi sabi natin kanina, okay, kapag sinabi natin digoxin yan, nakakapagpababa yan ng heart rate. Okay, nakakapag-slow down yan ng heart rate. Therefore, bago ka magbigay ng digoxin, you have to monitor first yung gamot, yung ating vital signs, specifically your HR or your heart rate or your pulse rate or your apical pulse, para magkaroon tayo ng baseline data if we are going to give it or if we are going to withhold it. Okay, pag once na mas mababa na ang kanyang apical pulse for less than 60 beats per minute, you have to what? Withhold the drug. Okay, aside from that one, you are going to periodically monitor for the serum potassium and digoxin levels natin. Sabi natin kanina yung ating digoxin level sa ibang book kasi ang kanyang therapeutic normal therapeutic range, it is 0.5 to 1.2 nanogram per ml. Okay, meron din nagsasabi na 0.6 to 1.2, but then nandun pa rin naman sila sa range. Okay, automatically kasi class, kapag masyadong mataas yan or at least 2 na or more than 1.2 or at least naging 2 nanogram per dl or ml yung ating ang ating range or ang blood serum level of this digoxin in our body, automatically it's already considered as toxic. Okay? Aside from that one, you're also going to monitor for your serum potassium. What is the relevance of this potassium class, of this electrolyte na potassium in our patients who are taking your digoxin? Okay? Always remember that your ano ba yung normal range ng potassium natin? It is what? 3.5 or 3, okay, sa ibang books, 3.5 to 5 mg per liter. Yan po ang ating normal range for your potassium. So, ibig sabihin, kapag nagkaroon ng imbalances in this serum levels, you have to monitor it periodically or at least, bakit maging cautious tayo pagdating sa magbibigay ng medication, specifically your digoxin. That is why it's very important for us to closely monitor tong mga serum levels na to. Okay, aside from that one, you have to assess for what? Renal function. Okay, renal function because digoxin is excreted by your kidneys natin. Kasi, ang importance ng ating tawag dito, ng ating renal function when it comes to the administration of this medication. Sabi natin, yung mismong excretion kasi, no, it is done by your kidneys. That is why, ang tandaan natin, kapag nagkaroon ng problem or renal dysfunction, possible din na magkaroon sa patient ng what? Ng digoxin toxicity. Kasi in the first place, kailangan na maging magandang clearance ng ating digoxin since kidneys ang tawag dito, involved na organ for this medication to be excreted. Okay? So, we have here your digoxin toxicity. Pag-usapan natin ang ating digoxin toxicity. Sabi natin kanina, ang ating therapeutic range, very, di ba? Very narrow ang kanyang therapeutic index natin or yung mismong margin of safety natin that actually your medication can produce your digoxin toxicity. Okay? So, ang importante dito, at least alam na natin na at least 0.5 sa Abler books or 0.6 to 1.2 nanogram per dl or ml ang kanyang therapeutic range ng ating digoxin. Okay, once na nag-exceed yan, ibig sabihin nun, magiging toxic na ang ating digitalis or digoxin in our body. Okay, at least 0.6 or 0.5 to 1.2 nanogram per dl or ml. Okay, so sabi natin kanina, that is why it's very important for us to monitor your serum potassium levels natin kasi once yung mga patients natin, okay, for those patients with hypokalemia, ibig sabihin ng hypokalemia, bababa ang kanilang potassium level, they have the higher risk to develop your digitalis toxicity. Kaya palagi nating tatandaan, kailangan nating i-monitor closely yung mga patients natin, okay, with their laboratory findings, kung masyado na bang mababa ang kanilang potassium when we are going to give, okay, prior giving your digoxin natin. Kasi once si patient, pag masyadong mababa ang kanyang potassium level, mas magkakaroon sila ng higher risk to develop your digitalis toxicity natin. Okay, individuals with hypokalemia actually class, they can develop your toxicity even when their digoxin levels are not elevated. Okay, so ano ba yung mga kailangan nating i-watch out na symptoms or signs of digoxin toxicity? Number 1, we have here your slow to rapid ventricular rhythm sa atin. Kasi sabi natin kanina, ang effect ng ating digoxin, pinapababa niya ang ating heart rate. Okay, that is your negative chronotropic action. Aside from that one dito, meron po tayong mga GI symptoms natin or pag nagkaroon si patient ng GI distress while undergoing this treatment, your digoxin, okay na ba yung mga GI distress signs natin? We have your nausea and vomiting, your anorexia, and your abdominal discomfort natin. Okay, aside from that one, kapag nagkaroon ka ng CNS effect, ano yung mga CNS effect natin? Possible si patient magkaroon ng blurring of your vision or possible mental changes natin. Dito sa ating blurring of your vision, aside from your blurring, possible din si patient na magka-develop ng mga halo signs. Okay, may nakikita silang mga halo signs na tinatawag or yung mga parang yellow spot in their vision. So that's already considered as sign of digitalis toxicity that needs to be reported immediately. Okay? So, aside from that one, sir, of course, meron po tayong antidote for this medication. Okay, ano yung antidote natin for this medication? Ano ang antidote for digitalis toxicity? We have your digoxin immune fab na tinatawag. Okay, we have your digoxin immune fab. That is the antidote for your digoxin toxicity. Actually, ang ginagawa nito, this is actually an antigen binding fragment ng ating derived from your specific anti-digoxin antibodies natin. Okay, and wherein yung dosage natin, nade-determine yan, no, by the serum digoxin level or the estimated amount of your digoxin that is being ingested. So, yun lang yung ating discussion for your cardiac glycosides. Okay, aside from that one, meron po tayong, what do you call this one? Para hindi siya makalimutan. Okay? Mas parang na na compress or parang mas na-summarize siya na natin for your notes natin for your digoxin. Okay? So we have here your digoxin or your lanoxin. Okay? Ang ating mnemonics for this one, we have your D-I-G-O-X-I-N or yung mismong digoxin natin. So number 1, D stands for what? Dig level or digoxin level 2 nanogram per ml or greater is considered as what? Toxic. Okay, kasi ang ating normal is 0.5 or 0.6 to 1.2. Next, for your letter I, inhibits sodium, potassium, adenosine, triphosphate. Okay, erase natin, saglit lang. Okay, adenosine triphosphate, that is an enzyme no, that inhibits your what? Inhibits your or pinapaganda niya yung mismong bilang ng ating intracellular sodium and calcium in our myocardial cells natin. G for what? GI and CNS signs indicate adverse effects. Okay, so for adult, pag nagkaroon sila ng toxicity, okay, that is for primarily nausea and tawag dito, nausea tuloy, mga CNS effect, okay? Or kapag stomach upset naman in your older child natin. Yan po yung mga nagmamanifest na adverse effects in our digoxin toxicity. Aside from that one, you have to monitor for output, intake, and weight should be monitored at all times natin. And aside from that one, you have to X, don't give if pulse is less than 60 beats per minute. And for letter I again, it is indicated for CHF or your congestive heart failure and atrial fibrillation. And aside from that one, N for note for potassium, your ECG, and as well as your renal function test natin. So that ends for our discussion for your cardiac glycosides.